Hello and welcome to the Neurodivergence and Mental Health podcast. My name is Sally Nilsson and I'm a psychotherapist, published author, public speaker and mum. I discovered my autism and ADHD aged 56 in March 2021, and having rewritten my life story, I'm on a quest to advocate for neurodivergent community. I hope you enjoy listening to my incredible guests sharing their experiences of autism, ADHD, dyslexia, dyspraxia, dyscalculia, Tourette's and OCD. We talk about growing up, education, work and personal stories, and how mental health has played its part in shaping lives. Our conversations cover spectrums, traits, challenges, acceptance and successes. So sit back, relax and find out what it means to feel, think and be different in a neurotypical world. Hello, Liliya, and I'm so happy to meet you. I've been reading about your extensive academic and business career within the mental health and neurodivergence field. And I wonder if you'd be so kind to just give us a quick introduction about yourself, you know, your full name and roughly where you live, and a little bit about what you do in the realms of neurodivergency, please.
Right. Well, my name is Dr. Liliya Wheatcraft. I used to be Dr. Bakieva for a long time after I got married to my husband, but eventually it got to the point where patients struggled so much to pronounce my Slavic surname that I just became Dr. Wheatcraft for them, for their sake. I live in Oxford, in Oxfordshire. So that's in southeast England. And yes, it is the Oxford University, the little city. What I do in neurodivergency, I would describe myself as autism guide, I guess. You know, when I was first diagnosed, it was quite a journey for me because I really struggled through finding myself as an autistic person. When I was diagnosed, yes, I kind of had an explanation for things, but at the same time, there wasn't somebody to talk to, there wasn't somebody to go through things and say to me, yes, this is autism, this is something you're never going to change. You may improve it, you may cope with it, and this is what you can do to cope with it, but it will never be different, no matter how much psychotherapy you're going to have. And what kind of things I could actually work on, you know, to improve myself. And this is with all my specialist knowledge. I mean, by that time I was a full member of Royal College of Psychiatry, and I struggled for about 2 years after the diagnosis, just reading and thinking and chatting online. It was really hard. So when I finally have got some model in my mind, I thought I really need to get out there and to help others to do the same, because so many other intelligent adults are getting diagnosed with autism these days, and they have no idea how to live their life after that, what to do, how to do things. So this is what I'm helping them with. And also I'm beginning to enter the corporate training field. Currently working on finishing my online/offline course. It's a bit of a social enterprise project, which I'm happy to talk about later. But yes, I'm autism trainer and autism guide.
Thank you very much for that, Liliya. And it is incredible when we're late diagnosed. You know, I was diagnosed this March 2021, autistic and ADHD, and I had no idea because I thought I was mentally ill during my life, and yes. And I absolutely felt as though I'd kind of had to rewrite my life story. But also, once I had some acceptance, same as you, I thought, I can't keep this to myself. I need to help other people. And I almost did it immediately. As a psychotherapist, I changed my directories, I changed my website, I came out loud and proud and just said, here I am, and I want to help. I can't believe it's only since March and so much has happened. And it's great what you're doing. Absolutely. We're going to talk about that later on. So thank you for that. Now, so you have an autistic diagnosis. Do you have any other co-occurring conditions?
I have ADHD as well.
So common.
ADHD.
Yes, it's so common, isn't it, to have ADHD and autism. And it's quite a fight and a paradox, isn't it? We constantly, our autistic mind is telling us to be structured and to do things in a particular way, rigid, repetitive. And our ADHD mind is saying, no, don't do that. I want to be impulsive. How do you find that?
It is... It has always been a bit of a challenge. For example, in my job as a medical trainee, we had to rotate through our posts several times a year, sometimes every 3 months, sometimes every 6 months. Sort of 3-4 months was just about the right time for me. When we were going for 6 months, I was getting bored because I learned everything I could learn at that level of training. At certain level of training, you're only allowed to do so much. So I have done it, I have learned it, and I wanted to move on because I was getting bored. But at the same time, I was dreading the changeover because it meant new people, it meant new faces, and remembering their names. And it usually takes me about 2 months just to settle in the new environment, just remember everyone's names and warm up to them. And that did affect some things. In one of the jobs, I actually received a direct feedback that nurses found me a bit funny the first few weeks, apparently.
A bit funny. I like that. A bit funny.
Yeah, but then they discovered I was all right.
Oh, well, thank God for that. I mean, it's, I do definitely get the boredom side. It takes, on the autism side, it can take such a long time to get to do something. But then when we do it with the autism and the ADHD, we become so hyper-focused. But then when we've learnt what we need to learn, we get bored. And the boredom is kryptonite. Boredom is crippling sometimes. Certainly for me, I hate being bored and I get angry and I want to drop it and run for the hills, really. I understand what you say about that. But when I look at all the things that you've done, I can see that perhaps, you do something, you've worked all the way through to the best of your ability. You may have written reports and thesis and done all sorts of things. And then you've done another one because you've got, is it microbiology, or you have a chemist degree as well, is that right?
I was an MSc I got a master's degree, yes, it's a 3-year research degree in Cambridge.
And was that epidemiology? I can't pronounce it.
That was epidemiology. And so it was a complex kind of project. It was based in clinical practice, but I was looking at a population of people and was analyzing their genomes and the expression of those particular genes and seeing if there is a correlation between the clinical symptoms and particular genes expressions.
And that, I mean, this is a conversation for another day that I didn't include in the questions, because you just brought something up really interesting about the Spectrum 10 project at Cambridge University, which, that quite a lot of the autistic community are worried about the eugenics and the sort of, looking at the genes and things like that. What do you, very briefly, because but I would like your opinion, what do you think about the Spectrum 10 project with Simon Baron-Cohen?
I think it is entirely understandable to have these worries, especially after the recent revelations of the quite revered figure, previously revered figure in autism history, Hans Asperger. So these worries and fears about the eugenics are completely understandable, but I think they are probably not justified.
And it is on pause at the moment. And I think my worry, and some of my peers who have been on the podcast and spoken about it, is the possibility that they're going to go away and use a different language, but bring it back as exactly the same thing. And we just don't want that to happen. Research is great, but we've had since 1930 to research autism. So
But we never had such opportunity to research the genes. I mean, the sequencing of genomes has never been able so cheap and so fast. Even compared to the time that I was working on my thesis, I spent several weeks sequencing like 3 gene variations of the same gene. And now you can sequence the whole genome in less than a day, if not an hour. So
that's incredible. And
I think,
yeah,
I think you have to take advantage of that. And I think it's possible that let's face it, not everybody celebrates autism, because the autism is a huge spectrum, and some people are hugely disabled by it. And I think those people would probably benefit from the potential outcome of such research. Would I want to be cured from autism? No, because that would mean I would be a completely different person, and I wouldn't have achieved anything of what I would have achieved. I wouldn't have been as loyal, as persistent, as honest, as I wouldn't have had my moral values probably if I hadn't been on the spectrum, and wouldn't have been able to blow the whistle, which might have been good for my career maybe. But for others who have severe epilepsy, or who are unable to communicate using any means, verbal, non-verbal, no means at all, I think for them it could hugely change their quality of life towards the better.
It could do. I mean, I agree with you. I couldn't have written the book that I wrote before without being autistic ADHD, because I wasn't academic, because I had processing issues. But then I suppose I might not even be on the planet. That's the thing. That's the problem I have about the eugenic side. It's the idea that you're giving somebody a decision to terminate a baby if they're showing autism, when you don't know what that spectrum is going to be like when they're born.
But that assumes or presumes that knowing that first, it presumes that you would have the ability to predict autism in utero, which you cannot, because now we are changing our thinking again, and we think that it's more of an interaction of environment and nature that actually shapes the autism as it is. For example, if I hadn't fought as hard for my child as I had, they probably wouldn't have been a honor student and studying at one of the Russell universities. But I had to fiercely advocate for them all throughout their school, up to the GCSEs and A levels. So you really cannot predict what the person is going to turn out like. So I don't think there will ever be the point at which you will be able to say, like with Down syndrome, which is a monochromosomal anomaly. So it's just one chromosome is affected, and it's just one extra chromosome. With autism, there are so many different genes. There are thousands of genes, and also the environment. It's just, I don't think anybody would ever vote, and especially doctors would ever vote for in utero diagnosis for autism.
Well, I hope so. And the autistic community are very much eyes on the subject, and we're going to be there and make sure that whatever happens, the autistic community agree and are not worried about it. I mean, I'm sorry to send you off on another tangent, but it was because
it's very exciting,
and I'm very interested, because you are a doctor and you have studied so much in this field. So you've mentioned that you have 2 teenage is it 2 teenage boys you have?
I have two teenage kids. One of my children just wants to be known as child.
Okay. Yes, and that's absolutely fine. And how old are they?
One is 19
Yeah.
and another one is going on 13.
Oh, okay. And because one of the questions I was saying to you is that you all your family members are neurodivergent, and that does make for an interesting family dynamic. I think I'm in the same boat as you in that respect. And are your family members what neurodivergences are they, if you don't mind sharing? Are
Oh,
they
we
all?
all have the same thing. We all have the same thing to various degrees. It's ASD, ADHD. I mean ASC, ADHD. So
Oh, right. Okay.
yeah.
And how have you managed that as a mom? Do you find that your own differences and your own spectrum, as you said before, actually, you have nurtured and worked really, really hard to get them through education and get the accommodations that they want. But do you find it a struggle? How do you cope with your mental health with having such an interesting family?
Actually, it wasn't bad until I developed the struggles at work, where incidentally is when my autistic traits became so prominent that they started interfering with things, where I couldn't just stop myself from telling people what I thought, and unfortunately, not everybody likes honesty. So you probably know that our autistic traits, our ability to camouflage them becomes impaired as we become more stressed and more unwell in any sense, physically or mentally. So this is what happened to me. Until then, I was sort of functioning okay. And then my autism became more prominent. The NHS declared that they don't need me.
They
And
don't
my
believe you. Did you say that the NHS didn't believe you?
no, they said that if I need so many accommodations, then modern NHS cannot accommodate me.
Oh, I can't believe that. It's so terrible, isn't it? The
No,
one.
it is psychiatrist. It was also said by a child psychiatrist who deals with autism on a daily basis.
And this, when I was diagnosed originally, it was by two psychologists who were neurotypical women, and they just said I had autistic traits. But I'd already done about 8 months of extensive research on myself and my identity and what I believed I was. And unfortunately, with my clients, I keep hearing it over and over again that within psychiatry and the psychology field, unfortunately, especially for late diagnosed women, think so much is missed. I mean, what do you think about that?
I think it's a really complex issue because on one hand, I completely agree with you. I do agree that a lot of women have been missed, and not just women, men too. I mean, at least 70% of my clients are men, adult men who were not diagnosed in time.
Yes.
Um, but the women were missed, and still, even when we come for assessment in adulthood, it's like, well, yes, you do have the traits, but is it enough for diagnosis?
Yes.
There is this some mental hurdle that the professionals just struggle to overcome, to reconcile this notion that autism is this condition that can be diagnosed, and a female can live with autism until the age of 30, 40 without diagnosis. It just seems something that they really struggle with. And on the other hand, there is, I don't know if you've read about 10 days, 2 weeks ago, there was an article in the Telegraph, I believe, and Jutta Fries was interviewed for that article, that basically said that the Professor Freeth is saying the autism definition has really been stretched beyond recognition, and I think that's not exactly what's happening. I think what's happening is there are a lot of psychiatrists and psychologists who have a little bit of a whiplash from the no, the autism in females is not possible, to every female that presents with query emotionally unstable personality, query autism, must be autistic now. And I think this is quite complicating the issue.
It is, you know, the psychologist said that I had autistic traits, but they didn't give me a diagnosis of autism. And I personally don't think there's such a thing as autistic traits. I think you're either autistic or you're not. And I got a second opinion by somebody who was very highly reputed, and they had no trouble in diagnosing me as autistic. But nevertheless, it's almost not the point in a way. If you are, however, you know, whether you're a man or woman, non-binary, trans, you know, whatever your gender and sexuality, if you feel and you've researched and you've looked and you've been on anything from TikTok to LinkedIn to YouTube to Instagram or books, whatever you've done, and you've come to the conclusion, I have got so many traits that I've diagnosed with. I mean, as a psychotherapist, self-diagnosis is 100% valid. And when people come to see me, there's no way that I'm going to say, no, you're not. And I had a client yesterday whose therapist was dismissing them, which is very dangerous to do something like that, I think. Don't you?
It is. It's terrible. But you know what? I actually did contact the Royal College of Psychiatry. They contacted the champion, the autism champion, saying we really need to change how we diagnose autism. And what I proposed is that we train a group of volunteers, perhaps autistic medics, better still autistic non-professionals. We train them how to diagnose autism and let them diagnose it, and then just confirm it with a professional, because I know the psychiatrists and psychologists will never let it out of their hands. So just confirm it with the professionals. Yes, no. They would be better than a bunch of junior doctors who've never met an autistic in their life, who've never seen ADHD. And they sit there with all pomp and knowledge, so to speak, and they refuse the diagnosis because they just don't understand. But you know, we have this. One of my friends here in Oxford calls it ADAR. When you're autistic, you kind of experience autistic empathy with another autistic person. So you just need to train autistic people to go and do this very important job. And then you would clear all sorts of the waiting lists. You would give people diagnosis. You would sift through the people who don't qualify for the diagnosis and who just want it for secondary gain. I never received a response.
I can't agree with you more. I really do get that. And when I look at my 56 years worth of experience as an undiagnosed and then diagnosed autist and ADHD, when I sit, I've niched now, so I call myself a psychotherapist and mentor for neurodivergent clients, and I say I'm autistic and ADHD. But when my clients come to see me, validating them and really listening and watching and seeing what they bring to the space that we're in, I can look at their body language. I can look at the different things that they describe, the challenges they've had from birth through school, in their family life, amongst their peers. And yes. I don't diagnose, and I'm not a psychologist or psychiatrist. It's unethical for me to diagnose or assess, but I can observe. And it's only when the time is right that I would say to a client, have you considered that you might be neurodivergent? And sometimes they say, well, I thought it was anxiety, but I'm seeing more about it. I've read an article, and then we can start the journey if that's what they want to do. Maybe they don't want to go for diagnosis, but I really agree with what you're saying. There should be more coaches, more mentors, more people who are neurodivergent, who are perfectly able to empathize and observe. And I mean, that's what we're so good at. We can see patterns in behavior, we can look at
Exactly.
body language, the eye contact and everything, and make a really informed, um, just an informed way of looking at them. I do agree with you. So when you, I'm just looking at our questions because we're going all over the place, and I absolutely love it. No, I think it's really, really good. Yes, something that is specific, we've spoken about sort of, genes and about looking at therapy and psychiatry. But one of the fantastic guests that I've had on this podcast is Paul Isaacs, who's very much an ambassador and so important for the autistic community.
He is great, isn't he? I have so much respect for him.
He's so good, and he wrote a really good article about depression. And then I've just started seeing a client. Of course, I'm not doing anything about confidentiality, but the person that I'm seeing is struggling so much because they went to I think incorrectly I don't know, they were put into a special needs school, but many of the people at the school had very, very much higher needs than the person did. And when they came out, they felt infantilized and actually were not trained or given any support as far as social interaction was concerned. So I've been working with role play, working with eye contact, open-ended questions, how to start off a conversation, just going really, really back to basics. But the big problem that this poor person has got is that it's not having the accommodation, not really going in the right direction to find out about language and to find out about how to communicate. And that has led them to have awful problems with dissociation, stress and depression, and it's been so hard. And I know this is an area that you work in. I mean, I know that you're an expert translator between psych language, lived experience and plain English, and that seems to fit in exactly with this particular client. But just for clients who might be quite articulate but find it, well, they're articulate in some ways, but they just find it difficult to live in a neurotypical world. Please tell me what you've learned and what you can give to our community when you have autistic people they might have pathological demand avoidance, they might have ADHD, they might have real big problems with emotional regulation, but it comes down to language. How can you help and what can you advise?
This is just something that I actually cover in a second module of my course, one of the many things. What I have learned after 2 years of research and thinking and reading, and I have said it before on Quora, where I have my own space, and other online media. What I have learned is that every person doesn't have just one age. We need to think of every person as having 5 different ages. It's the chronological age. So this is how old I am. You can be, say, as an autistic child, you can be 11 years old, for example. Then there is your biological age. This is how you develop biologically, your biological maturity. Is your coordination developing along with your chronological age? Are your hormones developing along? Are they going ahead of it? Are you developing premature puberty, or are you behind and you still haven't entered puberty at the age of 17? There are, the growth part of it, the disease that is associated with old age. For example, Down syndrome that we mentioned before. that is associated with premature aging. So if we develop cataracts at the age of 60, 70, they develop cataracts at the age of 20, 30.
Gosh.
So this is your biological age. And it's not just cataracts, the same age, they develop osteoarthritis, and they develop osteoporosis. So many signs of aging, they develop way too early.
That is absolutely fascinating. And
So this is the second one. Then we have the intellectual age, where autistic people frequently are way ahead. So you can be 11-year-old chronologically, but intellectually you may be 20.
Yes.
And then there come two ones that we really fall behind. That's social and emotional.
Yes.
And this is where we're being let down. We are being assessed as we are falling on that age spectrum. So if my child is 11, but their emotional development may be only at the age of 5, they will be labeled slow or stupid, and they will be put into a special needs school. They may be a genius, they may be a next Einstein in the making, but they will never get there because they will never get the nurturing that they need.
I really can see this, and it is very, very interesting what you say. I mean, just something. I have, hang on, 1, 2, 3. I've got 5 ages. This is incredible. It's slightly different to what you're saying, but not necessarily. I have within me the ages of 8, 14, 24, 45, and the age I am now, 56,
Right?
that are incredibly significant. And I know I sort of jump between those ages. There's also a part within psychotherapy, a model of therapy called transactional analysis, which is,
I know. Yeah, I know.
and it's parent, child, adult. And I absolutely jump between those. And then there's the other side where, just when I think, of some of the articles I've read, Dr. Ian Hale, I think is the person who I think is very, very interesting.
He's also a very good thinker, isn't he?
He's incredible. And the recent article I read from him, which I can accept this as an autistic person, and I'm perfectly practical and pragmatic about it, is the fact that I may not be long-lived on this planet. And I don't actually have a problem with that, because I don't want to be, in a bed in a hospital, 85 with multiple health issues. I've seen both my parents in hospital, and it was pretty horrendous. But there's that thing about we age because of all the stress and everything else that we carry with us, the co-occurring physical illnesses like fibromyalgia, autoimmune diseases, cancer because of the stress, because our immune is, and all this kind of stuff. And I don't have a problem with that. But one of the things within this, and I'm so fascinated about the different ages, is like hormones. Estrogen is a real problem for women with ADHD. And osteoporosis. I mean, I broke both my ankles last year, and I know my bone density is not great. And that's probably something to do with it. But the one terrible thing I'm coming across, unfortunately, with quite a few of my clients is suicide. I can think, very practically speaking, when I'm driving along and there's my favorite tree or there's my favorite cliff, if I'd had enough of life, and I'll just, off I go, sort of thing, But, I'm being flippant. But when I have clients coming to me and they really say, I can't do this anymore, and they think about suicide in intrusive thoughts, and sometimes to the point of planning it. How do you feel about that in all of your experience within the mental health field?
First of all, I think we cannot shy away from the conversation, and I'm a little tired of the trigger warnings about suicide, and I think it contributes to the stigma, and I don't think it should be stigmatized. I think it must not be stigmatized, because it is a completely normal human reaction to excess stress levels. I was suicidal and I obviously saw a lot of people in acute distress who were suicidal. And what I learned is you need to find something. You need to talk to the person because talking helps. Even, I knew that I knew the mechanism of it, and I know how it works. And still, I went to my GP every week when I was very low, and I talked about it, and it helped. So you need to not shy away, but talk about it. Ask them what have they planned, how they're thinking of doing it, what the people that they know would think about it afterwards. How would they react? Have they thought about the practicalities? And when you start talking about it, you destigmatize it, and you make it less of a thing that you will just need to jump into without any thinking before anyone stops you.
And
That is one thing.
I do get that, and certainly it's my ability to gauge how the conversation goes in the therapy room. Sometimes I normalize it, as you say. I don't talk about it as though it's stigmatized and, oh, I can't go anywhere near that subject. I actually normalize it. I say, oh, what method have you thought about? When did you think about it? Are you still thinking about it? And very often they'll say, no, it was something I thought about many years ago. And, and I can think about it when I'm feeling low, but I haven't taken action. I do agree with what you're saying about not putting a trigger warning on, but unfortunately we're not, it is difficult when you're talking about things like podcasts, because some people who may listen to the podcast, for instance, who are not autistic but may have mental health struggles, could get triggered, and I just have to be a little bit careful. But I think we should be able to definitely talk about death in all its forms, and speak about it normally. I don't have a problem talking about it, and I think we've got a way to go, unfortunately. But thank you so much for your
input. And just to get back to the suicide issue.
Yes,
I think what is most helpful is to ask the person, if they're acutely suicidal, what stops them? Because you find if they had wanted to do it, they would have done it. There is still something that stops them. So you need to tease it out from them. And one of my clients said that it was her little hamster.
Oh.
For me, it was my children. You need to find that anchor and play it up, bring it into the consciousness of the person that you speak to, and make them realize even more that it really isn't going to solve the problems, but it's going to bring in more problems into the lives of those that they still care about.
And that is and that is right. I mean, sometimes people think it's the final solution, the only solution, the only thing that they can do. But there is something about with men, because men often are very sort of action orientated, and if a man, there was a lot in the newspapers about the terrible rates of suicide within men up to the age of 43. They take action. If they're going to do it, then they will do it. Whereas women, on the other hand, they may do it in a different way. They may drink themselves to death, or they may try and take pills. It could be a cry for help. But you're absolutely right, and it is a question of listening and hearing and teasing it out in the space that you hold with that person.
Exactly.
And I'm not scared of doing that. I'm not scared of talking about it, and I hope I can help. And so with yourself, thank you for being so candid and mentioning that there had been times in your life where you felt suicidal. Are there any other times that you can think of, within your sort of timeline of age and what you were doing in your life, that you had particular mental health difficulties? For instance, it's the big four for me. It would be stress, anxiety, depression, and addiction. Did those ever come into your lives? And can you tell us about them?
Well, yes. Where to start? um, yes, I think, I was fairly well sort of balanced kid until I turned 14, and this is when I started in medical school. And throughout the first year, I was bullied merciless, and it wasn't, like a proper bullying. It was just making jokes. Oh, you still there? Oh, your pants, your trousers actually show that you have legs. Um, that it's not all fat. I was a little chubby when I was that age, and but it was all said with a joke and a smile, and everybody laughed, and I laughed alone. And then I just collapsed emotionally after a year of that. This is when my struggle with stress really started, and with anxiety. And then I started smoking because I sort of moved into a different seminar group. So I was with different people, but then I started smoking to sort of to fit in, to please them. And I started drinking, that's 14-year-old me.
Yes.
And then at the age of 16, actually on my birthday, sweet 16, I I started restricting, so I developed anorexia. And yes, I think it's an entirely different thing about anorexia, because I think it's all been managed very poorly. I got over it, and I think I would have still been anorexic if if I were managed like people are being managed here or anywhere really, because everywhere the the point of focus is on the weight, the
Oh,
weight of
yes,
the body.
absolutely.
It's not about the freaking weight. It's not about the bloody weight. It's
No.
about the control and our ability to focus on it, and
Yeah.
our ability to take the control back. What needs to be done is the person needs to have more control in their life, not less. And
Yes.
the energy, that extreme focus, it needs to be redirected into something more healthy.
And on the autistic side, I've been reading a lot about autism in girls, and the fact that 70 no, what is it, 30% of autistic girls are autistic, 30% of anorexic girls are autistic.
I think it's more than that, to be honest.
Is it? Yes, and of course all the people that slip through the net. And can you imagine, so you have your parents and you have an anorexic daughter, and you are just looking at the weight, and they end up going into residential care or into a psych unit with all the strip lights, the sounds, the noises, and everyone's
Yeah,
trying to stick tubes down your throat and making you eat. I
yeah,
cannot imagine anything more traumatic. You're doing the absolute opposite of what you would need to do with somebody who is trying to
exactly.
find control in their lives, aren't you?
Exactly. And you know what? I actually experienced it not so long ago. In April, I was admitted in coma, to be honest, to the local ICU unit. And they took the history from my husband. My husband mentioned all my diagnoses. In the history, he said she had anorexia, but it stopped before our son was born. She also was diagnosed with autism and ADHD, and that was, he didn't think about it anymore. Now, of course, because I have diabetes, and they saw the word anorexia, and they couldn't make heads or tails of my condition. What apparently was decided, and I still haven't seen my medical records despite requesting them, but what apparently was decided is that I had anorexia, and I went into coma because of not giving myself insulin. And I went through all this humiliation that you were just talking about. They put the nasogastric tube into me 3 times, and I
Oh,
kept pulling it out. The nurse assaulted me. The nurse assaulted me because I was desperate not to have the NG tube
yeah.
down my throat overnight feed. They were sticking their head into the toilet. They wouldn't let me go pee or poo privately because, oh my God, what if she is vomiting in there? They were treating me like a full anorexic patient. They were weighing me daily. They never even told me that they were doing this. I only connected the dots later on, that this is what they must have been doing. This is why they were so insistent on putting the NG tube down. This is why they were so insistent on having somebody sit with me all night, make sure that I didn't take it out, despite me eating at that point, despite me eating at that point normally. Thank God my husband came, and it so happened that they didn't give me insulin on time. Oh yes, and they removed my pump, so they removed any sort of control that I had over my body. And they removed my pump, and they didn't give me insulin on time, so my blood sugar went very high. And it's not very well known, but when your blood sugar goes high, you become aggressive. So I became...
I've heard that. I've seen that actually on a documentary.
Yeah, I became very upset, and I started yelling, and I wanted to leave. They threatened me with mental capacity act, and even my husband was unsure if I would be detainable or not. And I was telling him, look, I'm not detainable because this is what. Just because you disagree with medical professionals doesn't mean that you lack capacity.
It's terrible. It must have been.
Finally,
such a terrible experience.
It was horrible. There is a great article by a psychologist in the 70s. It's called on being sane in insane places, and it talks about how people are treated in mental ward, even though they were completely healthy, completely without any mental illness diagnosis. They pretended to be ill, they were admitted, and from that point onwards, everything that they did was somehow related to their so-called illness. For example, the researchers who were making notes, they would be characterized as the patient is engaging in obsessive writing behavior.
And the thing is that you go in as autistic, and you've gone into coma because of diabetes. But lots of people who are going into psych wards, into the excuse me, the different places that they're going into, you might not have been mentally ill when you went in, but for goodness sake, you are when you come out.
Because I totally
would have PTSD, yeah. Aren't you?
Yes, absolutely. I mean, I think I have PTSD because every time I talk about it, I can't help getting flashbacks. I can't help getting emotionally upset about it.
That's so terrible. And another side of that, which is also very relevant into this, if you don't mind, because I could talk about what you've just said for another hour, and I think maybe I'll get you on again to specifically talk about eating disorders at another time, if that's okay. But something that one of the human givens therapists specializes in, and she worked on a psych ward, is the terrible thing that they do when people self-harm and they're cutting, and they know what they're doing, they're in control, they have their blade, they have their swabs and their, everything that they need to cut. But when they go into the psych ward, they're punished and everything's taken away from them. So all of their control is taken away, rather than being able to say to the person, you can do it in a controlled way and we'll keep an eye on you. And when you take control away from the person, it's everything. It's hugely traumatic, isn't it?
It is absolutely terrible. And it's not, it's not just about taking the control away. It feels dehumanizing.
Yes.
Completely dehumanizing. It becomes not even about control. It becomes about seeing you as a whole human being.
And talking about that and that huge pathology of what that is like, a lot of people, and I have my own views on it, but I'm a psychotherapist. I'm 100% with my clients, whatever they want to do. And I do believe that it's a multi-pronged, it is multi-pronged. So you have your family and your friends, your GP, your psychologist, your psychotherapist, and you might have medication. But I do have some of course, I'm talking to you and you're a psychiatrist, but I do have concerns about medicating, because I feel, you know, talking about being in the psych unit and the feeding and everything else, I worry that people who are different, who have got a different neurotype, are being medicalized in order to fit in with the normal society, the neurotypical world, instead of working with calming down the stress, looking at the environment and helping them with their emotional needs. And I just see a time when human beings, that's what we are, human beings are medicalized to calm us down, to make us conform. And I worry about that. What do you think about medicalizing, I suppose specifically ADHD, but medicalizing autistic people with anxiety and depression medications?
That is very interesting what you say, because I actually have experienced that myself, you know, when I was kicking up the fuss in the local Oxford University hospitals with my diabetes and my so-called anorexia. They tried to, they were pushing diazepam down my throat.
Yeah.
You know? And I got so angry. I literally pushed it out of their hands and said, no, you're not going to get me addicted to another drug.
Yes.
This is just incredible. Another example to you, I had an incredibly supportive consultant in occupational health, Dr. Evie Kemp, who also works for the same hospital, actually. And she kept asking me every time I saw her, and I saw her monthly for 2 or 3 years. Do you think anything else would help you? I would say, yeah, getting my job back and having no problems. And each time she would say, yeah, I can see that, but I can't do that for you. Is there anything else that we could do?
Yes. And that is it. That is it. It's you, because you see, you go to a GP and sometimes, and you don't know, perhaps you don't know you're autistic or neurodivergent, and you go to a GP and they are going to write out a prescription, or they're going to send you to some online messaging telephone type NHS CBT, and it doesn't work. It's, I like to think that for neurodivergent people, you've got to feel safe in your body, you have to feel safe in your environment, and you need to feel safe with the people that are around you. Yeah. And that is what you were saying earlier. It's talking together and listening, isn't it? And seeing how emotional needs can be met and what needs to happen to bring the stress levels down, because people are living with such terrible stress. And as I was saying before, that can go into fibromyalgia, ME, migraines, terrible back problems. And then you're given loads of medication for that. So often we're misdiagnosed, we're mismedicated, and people are going the wrong routes for what they really need.
Absolutely. Can I just say though, there is a point, and Temple Grandin writes about it in her book, and then Oliver Sacks mentions it in his book about her. She reached a point in her adolescence at which she could no longer cope with anxiety, and she found a tiny dose of medication very helpful. And I think it has to be the person's choice. I mean, yes. I do take medication myself for ADHD, and I find it helpful. With my children, my son was first prescribed it when he was 9, when he was diagnosed, and I said to him, you can take it or you can not take it. Here is the one tablet. If you feel you don't like it, if you feel any side effects at all, if you just don't want to take it, it's your life. I don't want to force it upon you. And this is very important, because you know that the majority of children with ADHD who do get medication, and they may improve their performance at school and their behavior, etc. But do you know that the majority of them stop taking medications the moment they reach 16?
No, I didn't know that. That's very interesting.
Because it was forced down upon them, and they just like with insulin for young diabetics, it becomes a point of rebellion. So I gave my children total freedom. I said, look, this is here. This is for you. You want it, you need it, you take it. You don't want it. And, my other child is not so keen. So we take it when we need it, when we need to focus for an extended period of time, when we need to do some schoolwork or homework. But otherwise, it doesn't. It's not my body. It's not my life. I cannot force something upon you. And I think you should see it from the child's perspective and see my child wanted it. My older child wanted it because he's very academically oriented, and he was frustrated because he was trying really, really hard. And this inconsistency in performance in ADHD and autism, where one day you try really hard and you do extremely well, another day you try just as hard but you do very poorly. And the teachers kept saying, oh, he's not trying consistently, he's not trying hard enough. And then we tried the medication, and he loved how it made him able to do his best. So he continued. My other child is not that academic. They are bright, but they're not, they have other interests in life, and that is fine. And if they don't want the medication when it's not absolutely required, it's fine. But that is being taken away from children.
What, the choice?
Yeah, the choice is being taken away from children. This is what I'm against. I'm not against the medication. I am against the forcing the medication down upon children, but equally, I'm against withdrawing the medication from children or withholding it when the child would benefit from it, and there is not even a trial of it.
One thing with ADHD medication, which is good, it's the good thing about medication, which is different to medication that you would take for psychotic behavior, through stress or depression, and sertraline and all these different medications. With ADHD medication, they're often very short-lived, which is what, so you can take them for certain things and then you'll go back to normal afterwards. But yeah. I did read that sometimes medication, you take it and it stops working. And there was a stigma, or there was a thought that some medications could be addiction forming. What do you think about that?
Any medication can be addiction forming. The opiate epidemic, I was one of the doctors who was saying, oh no, if you have pain, you cannot be addicted. And I was prescribing, codeine, and I was prescribing Oromorph in the hospital freely because I really believed that. Ultimately, I think any medication can be addicting. If you think about the medication and getting used to it, that is also true. For example, venlafaxine, many people who are on medication venlafaxine, which is very good for anxiety and depression because it has dual action. Yes. But if you stop taking it suddenly, you get horrible headaches, and it's like a jolt in the head. And I have taken it, and I know it from personal experience. You feel, I don't know how you feel with opiate withdrawal, but you feel really bad.
And I think it is so important for GPs and psychiatrists to be really managing it all the time, not just writing the prescription out, but getting people to come back. How are you feeling? What are the side effects? Is this working? What do you think? I'm just looking at time, and I wonder if you would be kind enough. I always ask my wonderful guests, this one question, which if you could sum it up in a couple of minutes. Of course, it's a gigantic question, and I'm asking you to do it in a couple of minutes. So sorry about that, Liliya. The question is, how would you like to see positive change at home, at school, and in the workplace to help all neurodivergent people be included and valuable members of society?
I think what we need to do is, number one, we need to get rid of this, alien thinking. I think it is hugely dehumanizing, and I think it is really stigmatizing. I understand why Oliver Sacks did it a while ago. That was about 40 years ago, 50, when he wrote his The Anthropologist on Mars about Temple Grandin. But there is no reason to still have children books on sale that say the Martian on the playground is there, because we're not bloody Martians. We are people. We are humans, just like anybody else on this planet. And thinking about me as an alien automatically makes me, in your mind, automatically makes me somehow unintelligible, somehow impossible to understand. So I think this is the first step that needs to be taken. Second step that needs to be taken, we need to accept that autism is a very diverse condition, and we need to give this, to send this message to the neurotypical community. Like many people said, like Oliver Sacks said, Jutta Fries said, it is so diverse that it's impossible to give once-off recipe for every possible situation, which I think is a lot of what current autism training programs do. And current autism training programs, they are put together, most of them, by the vast majority, put together by people who have no connection to autism, who know nothing about autism. So it's just rubbish. Pardon my language.
That's all right.
What we need is go to the first principles, and this is what I'm trying to do with my autism guidance, with my autism training course, where I separated sort of 8 guiding principles, and they all make a very nice mnemonic autistic. So the first, each letter stands for a different quality. For example, A stands for anxiety, because it's a huge thing. How many people know that we steam because we're anxious? How many people know that we have meltdowns because various sensory inputs drive us into the super anxious state? How people know that the routines and rules and rituals, they are all sort of ways of managing our anxiety, uncertainty, lack of control. How many neurotypicals know that? Not many.
And I think I would love very, very much on that, because I did read about that autistic and what it all stands for. And I think I'd love to ask you to send me the links for the different things that are important to you, that you can that you think our listeners will really benefit from about that, because you unfortunately we've come to the end of our podcast today, but you're absolutely right. So many things just on the A of autistic for anxiety, and I would love to know what the other letters stand for. So please do send that as a link. And Liliya, thank you so much. This has been an incredibly interesting and so comprehensive, and I've learned an awful lot from our time together today. And I would like to get you back on again when I'm thinking about focusing on particular topics, if that's all right.
Yes, sure.
That will be really good. And so thank you so much for coming on the podcast today. And I'll continue to follow you on the platforms that I see you.
Thank you very much, Sally. I had a really good time, and it was very nice talking to you.
Thank you once again. Brilliant. Thanks, Liliya. Take care.
Bye.
Bye. Thank you very much for listening to the Neurodivergence and Mental Health podcast. Links and resources will be at the end in the show notes. I very much look forward to meeting you again. Thanks for listening. Bye.